We'll have our first speaker coming up, Jessie Berry, who is at USC. She's the Associate Program Director and Associate Director of Ocular Oncology there. And we're happy to have her come and tell us what we need to make sure we don't leave residency without. Thanks, Jessie.
Thank you. Good morning, everyone. I'm Jess Berry, happy to kick it off today. So I put a lot of hats on this first slide because I wear a lot of hats. Treating patients, research, some hospital administration, and some education, and I'll be around this morning and happy to talk to you guys if you have any questions. But in the couple of minutes I had, I wanted to set two stages for you guys, and this is something I always tell my residents to do, and it's something I do myself in my my to-do list or my set of goals. So you need some lofty goals, and you need some just like quick take-home points for you to think about as you're completing your residency. So as you come to the end of it, celebrate the last 3 years. Take some time to really be grateful for the amount of education and knowledge and skills in your hands and in your head that you've had. Do something fun or special for yourself. Even if you do fellowship, you're a little bit closer to having an attending paycheck. So if it's a splurge on a vacation or something that you've wanted, celebrate what you've just done. Then plan your next 3 years. So again, that's the idea of dreaming big and having big goals. What are you going to do in the next 3 years? Again, regardless of whether or not you do fellowship, you're going to start a job, you're going to start a life, you might buy a house. Start to think about those big things. And then take some time to really envision what your ideal career looks like. Do you want to see patients 5 days a week? Is that what makes you get out of bed in the morning? Do you want to operate all the time? Are you excited about that? Or do you actually hate operating and you want to do something that's more medical ophthalmology or more research? Really know yourself. Ophthalmology is awesome. There's multiple subspecialties. There's no cookie cutter way. In residency, this is something I say a lot, but in residency, you're not given a lot of license to think about what you like because you are told to go to glaucoma clinic and told to go to retina clinic and told to go to cornea clinic, right? But think to yourself, on those days that I'm in X or Y clinic, when do I love it? Which cases do I love going to if they last 4 hours, and which cases do I love going to if they last 4 minutes? You need to like the easy stuff and the hard stuff of a specialty. And then here's the nitty-gritty. So you guys should write this down. I tell all of my residents this. Really, you need this before you leave. If you just graduated, reach back out to your residency program. Keep a copy of your signed ACGME case log. You may need that for credentialing. I actually needed it at the VA in order to do intravitreal injections because I'm not retina trained, but I had done, I think, 200 injections in my residency. So they allowed me to inject. Okay, so keep it. Know your cataract settings if you plan on being a cataract surgeon. You'll be amazed at how much you think you know because you stare at them every day and then you get in for your first case and you're scared and you're nervous and you forget. So know them. Make contacts with your local reps and have them introduce you to the reps in the new places. This includes if you're going to fellowship. That's very important. Leave a small present for your coordinator. You're going to contact her for years and ask her to sign credentialing forms. And then make a credentialing file. Don't ignore me on this. You're going to do credentialing forever. It should have your CV. It should have copies of your diplomas. I can show you mine if you're interested in it. It has about 20 folders, and it makes credentialing, which is usually an 80-page file, much easier. So that's the nitty-gritty for you guys, and I'll be around if you have any questions. Thank you.